Good morning. Hello, my name is Matt Molitor, and I am a social emotional learning coach in the MSD of Wayne Township. Welcome to the Mental Health and Wellness Series 22-23, sponsored by the Office of Special Services, Cummins Behavioral Health Systems, and Project Aware. Thank you for being with us today. We are hopeful that you're going to walk away with valuable information that will help you in your role supporting staff and students. Before we begin, I just want to make sure you are aware that questions should be entered in the Meet chat. I will be monitoring the questions throughout the presentation and help make sure they are addressed at some point during the presentation. At the end of the session, we will allow Lindsay to answer as many questions as time will permit. The sessions will be recorded and made available on the OSS Hub for your convenience. At the end of today's session, you will be asked to complete an exit ticket where you will choose a book you can add to your personal professional library. We also invite you to provide feedback, which is a valuable gift to us. Now I am pleased to introduce Lindsay Kuzy, the Education Behavior Coordinator for Cummins Behavioral Health Systems, to share about today's topic.
Thanks, Matt. Let me get my screen shared here. All right, are we good on your end? Can you
Yes,
see
I
my
can see.
slides?
We sure can.
Awesome. Okay. Thank you for having me back. I'm really excited to be here today. Again, my name is Lindsay Kuzy. I am the Education Behavioral Health Coordinator with Cummins, and I am a licensed mental health counselor, and I'm certified as a clinical trauma professional, a compassion fatigue professional, and an advanced grief counseling specialist. I'm also a QPR gatekeeper instructor, so that's suicide prevention. We are here today to talk about reducing stigma through the understanding of mental health diagnoses and treatment. This is going to be kind of the intro. And the next time we come together, I think in April, we will talk more specifically about 3 diagnoses in particular: anxiety, ADHD, and trauma, which isn't a diagnosis in and of itself. But we'll talk about those things next. So we'll deep dive. This is just going to be kind of a broader overview and really focusing on how we can pull back on stigma and what that looks like. So today we're going to do just that. We're going to talk about 5 ways that we can reduce stigma. And we're going to do this by talking about educating on mental health, sharing real life examples, what that could look like, talking about mental health as a range of symptoms, really understanding what that means, listening to and supporting others with mental health concerns, and then sharing stories of overcoming. So this is what stigma could look like, right? These words can promote stigma. The way mental health problems are portrayed in the media also promotes stigma. So using things like the word, that was crazy, or that was insane, right? Those have really negative connotations just from how they've been portrayed in the media and how they've been used to describe people, both with mental illness and without. So stigma is defined as when someone views you in a negative way because you have a distinguished characteristic or personal trait that's thought to be or actually is a disadvantage. So let's hop into this a little bit. Educating ourselves and our youth about what mental health is and how we can learn about those disorders. So Dr. Westers is a clinical psychologist at Children's Health, and he said mental health problems are often portrayed incorrectly in movies and TV shows. They can paint characters struggling with a mental health problem as incompetent or even violent. Mental health disorders are treatable, and when we frame mental health in that way, children can start to feel more hopeful about seeking treatment. Right? Some of these movies are older. They would be movies that we've seen, but in Fight Club, he has a split personality. One Flew Over the Cuckoo's Nest, The Joker, just all of these have been portrayed in really negative and violent ways. So there's many, many types of mental health problems. We'll briefly talk about the most common in the next few slides. Approximately 12 million children under the age of 18 have mental illness or a disorder, a diagnosed disorder. And this is about 1 in 5 children at any given time. Many of these don't receive any services or the services they need to help their mental health. And we know that right now, right? We, as a mental health clinic, know that we are struggling we just don't have enough to keep up with the demand. 2 years ago, I had an intern who told me that there was one mental health professional for every 628 people in the state of Indiana. We just can't keep up with what the demand is right now. There is so much need for mental health services, and either for stigma or because the services aren't available to them, they're not getting the treatment they need. So, a mental health diagnosis is a condition that changes a person's thinking, feelings, or behavior, or all three, and that causes the person distress and difficulty functioning. There's lots of pieces that go into this, but really genetics, environment, and social factors interact with each other to influence whether someone develops a mental health disorder or a mental health diagnosis. So let's dive into very briefly some of the most common things that we might see. Since 2020, I would say that most everyone has experienced some sort of trauma. So a single trauma are those events that are singular or repeated at unpredictable intervals. They're real or perceived threats. If you've been in these trainings before, we've talked about your amygdala doesn't decipher. It doesn't tell the difference between a real or a perceived threat. That smoke detector just goes off. Complex trauma are those developmental environments that train reaction. So this is complex trauma where a student might be experiencing the same things over and over and over again, creating characteristics in themselves. Remember that the trauma becomes trauma when it overwhelms the brain's capacity to cope. It's not a logical phenomenon that happens. Trauma is very sensory focused. Anxiety, this is a really concise definition that Dr. Faith Harper gave. It's really that feeling of dis-ease where you feel like you have to act or it feels like a lot's going on inside. So if you've ever had that feeling of, did I lock the door? Or did I turn the stove off? Did I unplug my curling iron or my straightener or whatever? Those pieces where you're like, I better go check on that. If you've never had those feelings, that's amazing because those feelings are really hard to deal with, especially if you're in moments where you can't deal with them. So it's really that full body just kind of disequilibrium and it demands your attention in some way. So everybody has worry. Anxiety, being diagnosed with anxiety is really to another level. It requires that second piece. It requires that more active piece. According to some research, prevalence of anxiety, according to the National Institutes of Health, nearly 1 in 3 adolescents ages 13 to 18 will experience anxiety disorder. The CDC is estimating 9.4% of children have an anxiety disorder. Again, not all are diagnosed, right? Especially if we've got younger students that we may not recognize that this is anxiety, because anxiety, as we'll talk about in the next presentation, really can come out in so many ways. We will talk about it a little bit later today too. So depression, it's a mood disorder and it causes persistent feelings of sadness and loss of interest. All of these diagnoses have to affect big parts of our life. So feeling sad is pretty normal, but when it takes that sadness to a level of not being able to function, not being able to concentrate at school, not being able to engage in activities at home, loss of interest in things they used to enjoy, that's when it becomes diagnosable. That's when it becomes that bigger problem. Prevalence, along with ADHD, behavior problems, and anxiety, depression is one of the most commonly diagnosed mental health disorders. It's at about 4.4% of students. So oppositional defiant disorder is a little bit of a shift. This is more of a behavior disorder. And children diagnosed with this show symptoms of being uncooperative, defiant. I'm sure all of you can think of one student that might fall into this category. They're the ones that just kind of want that fight. And it's a behavioral disorder in the DSM that we use to diagnose. So that's where that falls. It's a little bit different than those mood disorders of depression and like we just talked about. sorry, that was depression. Let's look at by age what this looks like comparison-wise. So we've got depression, we've got anxiety, and we've got behavior disorders. We can see from ages 12 to 17 for depression and anxiety that it really kind of skyrockets. Behavior disorders are really in that 6 to 11 range, which they should be, because that's really when we start to see them come out, get diagnosed, and then usually that's where we can start to help. So what is ADHD? ADHD is a neurodevelopmental disorder. This really affects the brain. It affects the way that they think. It affects multiple pieces. Controlling impulse behaviors can be pretty normal in young people, but this is just at a different level. Along with some other diagnostic criteria, symptoms need to be present before the age of 12, which now with technology and social media, we're seeing some differences in that. And that's a whole nother presentation that we have, but we are starting to see some people being diagnosed later. And is that because we're changing our brain through technology to be used to those quick snippets? My sixth grader, when he was in kindergarten, his teacher even commented on how difficult it was then to be able to keep the attention of the students, because she talked for longer than 90 seconds or a 2-minute video, and she wasn't all colorful and bright and shiny and moving, right? She was sitting and talking like a teacher would, reading a book or teaching, whatever she was teaching on her board that day. But just those little pieces are starting to change that brain. And what does that look like? So the prevalence of ADHD, it's one of the most common childhood disorders. 9.8% of youth, or approximately 6 million youth, are diagnosed with this disorder. Estimates for ever having a diagnosis among children age 13 to 17 are what we're talking about here. So neurodivergence is kind of a new name. The term neurodivergent came from the related term neurodiversity. Judy Singer, an Australian sociologist, coined the word neurodiversity in 1998 to recognize that everyone's brain develops in a unique way. Neurodivergent is not a medical term. Instead, it's a way to describe people using words other than normal or abnormal. And that's important because there's no single definition of normal for how the brain works. So this is an example of how we can move to less stigmatizing language, right? Because neurodivergent is just to say that somebody's brain works differently than somebody else's brain. And so as you can see in the circle, really those pieces that fall into a neurodivergent brain are things like autism, spectrum disorder, ADHD, dyslexia, Tourette's, intellectual disability. There's a lot of pieces here that fall into that neurodiverse brain. And then one of those under there is autism spectrum disorder, and that's a developmental disability caused by differences in the brain. They have social problems, communication, and interaction, or restricted or repetitive behaviors or interests. So that's kind of where that diagnosis comes from. So we're going to talk now a little bit about how mental health problems have that range. So now we know a little bit about how we can use the words of the diagnosis a little more appropriately. Now let's talk about what these can look like. So there's a lot of overlap, right? Look at how much overlap there is with ADHD and trauma. Shared, there's agitation, irritability, disorganization, poor self-esteem, problems concentrating, inattention, distraction, right? All of those are the overlap when it comes to ADHD and trauma. And kids will cover up to hide shame and embarrassment. So it could be trauma, or it could be them trying to overcome something with ADHD. So this is really hard when it comes to identifying. When we're in therapy, we really have to kind of dig down to see what's really at the core of what's going on. So here's this range with ADHD and oppositional defiant disorder. All these different symptoms could be things that we're seeing when it comes to these diagnoses. And you'll see there's a very big center here where it talks about irritability, anger, difficulty regulating emotions. So those three things right there are part of an emotional intelligence. So if we have students that are showing prone to anger, difficulty regulating emotions. It could be that they have something diagnostic. It could be that we just need to work on teaching coping skills and increasing that emotional intelligence for them. As you can see, again, there's a range of symptoms, and there's a range in these symptoms of intensity as well. So somebody with ADHD could have difficulty with organizing, meaning their desk is, just shoved papers. There's no organization to it. But for some, it could be they just have difficulty kind of remembering to put something in a certain spot, but their desk may be a little more organized. So there's a range also when we're looking at each of these symptoms. Depression and anxiety, again, lots of overlap with worry. So a lot of times it's difficult to see the difference between depression and anxiety because there can be that worry piece that overarches both of them. Anxiety, we usually feel a little more amped up, whereas depression, we're feeling a lot more fatigued. But on the flip side, with anxiety, if it's been so high, it can be pretty fatiguing, but it's where those thoughts differ that we're going to look at what the function really is. This is a really big one. ADHD and autism have a lot of overlap. Oftentimes we have students that are diagnosed with both. Oftentimes we can't figure out if it's ADHD or autism. So there's a lot of crossover here. Again, really with both of these, it's just what are the symptoms? And from our standpoint as a mental health and for teachers too, it's what are those things then that we can do to work on the symptoms? If they have ADHD, if they have autism, I know that can affect IEPs and 504s and all of those really important pieces. But what are those things symptom-wise that we're looking at that we can really drill down and focus on while having this awareness that there's a lot that could be going on? And then we have ADHD and anxiety. So again, there's some impulsivity. It's that movement. It's that hyperactivity piece that we're talking about here. About 3 in 10 children with ADHD were also diagnosed with anxiety. A child who's easily distracted could have chronic anxiety because they're constantly trying to worry or think about what else is going on. So that's having some understanding of those other pieces. So having a conversation and talking openly with others about mental health, listening to and supporting others. One way to normalize this, which you all have that's really amazing, you have so many social emotional learning coaches. In our district that my kids go to, we have one social emotional learning coach for all 8 of our elementary schools. They're not getting some of this normalization around mental health, around the words that we use. It's also important to use the correct terminology. So we don't call somebody a depressed person. We say somebody who has depression. We use these other words because we want to show that a person's more than a diagnosis. So it's not an autistic child, it's a child with autism, right? We flip up how we're describing them so that we're using person first language. Using the feelings words can really help to dive into allowing them, first of all, it increases their emotional intelligence, but it also just destigmatizes I'm feeling sad, and that's okay, right? If I cry, it's okay because I can use my words and I understand what this means. So really talking openly about mental health is not just talking about depression or anxiety, but it's working with them to understand the words that are a part of that diagnosis. So talking about feelings requires vulnerability. So Brené Brown in her book, Daring Greatly, defines vulnerability as uncertainty, risk, and emotional exposure. So to feel is to be vulnerable. So as we're going into working with our students, we teach that talking about our feelings can be vulnerable because in the past, maybe they've said they've been sad and they've kind of been dismissed. Or maybe when they get angry, it's hard for them to say I'm angry at first because they go straight to getting into trouble. So there's ways that we can work through this. in starting to use those feeling words in morning meetings or at the end of the day, or if you're in middle school and high school, if there's homerooms, maybe it's in homeroom that we're doing this. But there's an exercise that Brene Brown talks about that's called a 2-word check-in. Maybe you use a 1-word check-in. Maybe it's something that we just identify what feelings we're feeling that day. But this 2-word check-in really starts to break down that vulnerability by allowing them to use feelings words to describe what's happening. And those feelings words could be, I'm tired. It could be sad. It could be happy. It could be excited, right? We minimize it so it's not a full sentence, but just a feelings word. And it really starts to help them identify where they're at. Maybe that's too much. Maybe you have a feelings chart. So maybe you have these guys from Inside Out, and maybe they come in and maybe they place their face or their name or a sticker or something on which one they're feeling that day. And that way you also have an idea of where we're starting for the day. What are we doing for the day? How can we work through this today? So ways that we can also start helping our students is through increasing their emotional intelligence. Many people call this their soft skills, but the soft skills are some of the reasons we're seeing so many struggling in high school and college right now. Many of our students are lacking this emotional intelligence. Some's due from the pandemic, could be from technology, could just be because they're adolescents, right? But emotional intelligence is the ability to use, understand, and manage emotion in a productive and healthy way. So again, if we're talking about emotional intelligence and not calling it a soft skill, but calling it an important part of being able to learn, to have conversation, right, to be motivated, it helps us to be able to communicate effectively, empathize with others, and overcome challenges. Emotional intelligence is learned through observing voices, body postures, and facial expressions. And this really comes from Daniel Goleman's mixed model. And he talks about self-awareness, where we know our feelings, understand our emotional triggers, and know how to deal with them. That is right there. If we have self-awareness to know that it's okay to have these feelings, to understand that people are going to trigger us, and that I know how to deal with this because I've been taught, that right there can help to end stigma or decrease stigma because we're talking about it. We're putting it out there and it's okay to do. Self-management is keeping emotions in check when they become disruptive. Motivation is the higher your emotional intelligence, the more intrinsically motivated you naturally are. Empathy, again, goes into this destigmatization. If we can support others' emotions, we can support them through their process through a mental health journey. And then we have communication. So the ability to communicate in person with others. Again, in person with others. So again, if we've got those pieces, it starts to break down the stigma because this is something that they are just used to having. We're talking about our self-awareness. We're talking about our self-management. We're talking about how to be empathetic with others. Lots of things we're already doing with social emotional learning, but it could also be adding into those things of, at the end of the day, did anybody help anybody today? Did you get helped today? It's helping to identify not just if I go out and help somebody, but if somebody helped me today, how can I make them feel good too? We're going back and forth on what that looks like. If we all had a higher emotional intelligence, we would be comfortable with the vulnerability of discussing our feelings or reaching out if we need support. We're really finding on college campuses right now, there's this weakness between students' emotional and thinking brains. They don't know how to reach out for help. They also don't know how to have conversations in their classrooms. And it's just creating this bubble of students that are leaving or are not thriving in those environments. So we're going to treat our mental health as part of our healthcare. So this talks about stories of overcoming mental health disorders. We would not tell someone with diabetes to just think positively and diabetes would go away. Now, there's some different pieces to what mental health and diabetes do in the body, and we're going to talk about that in a minute. Children need to know that They need to see a doctor when they have an illness or an injury. And the same is true when they struggle with a mental health problem. Talking about mental health as part of their overall health really helps remove any shame or embarrassment. So, overcoming these begins with understanding what's going on in the brain. So, the basic functional unit of the brain is a neuron, and this is a specialized cell that can produce different actions because of its precise connections with other neurons, sensory receptors, and muscle cells. So, neurons communicate using electrical signals and chemical messages, and most scientists believe that mental illness or mental health problems result from problems with the communication between neurons in the brain through that neurotransmission. So, for example, the level of the neurotransmitter serotonin is lower in individuals who have depression. And this finding led to the development of certain medications for the illness. So, it's not just that you're blue and you can just positive psychology your way out of it. There is a change in the brain. There's two main classes of neurotransmitters. There's the excitatory and inhibitory. So we're going to just really briefly talk about what these look like. So adrenaline is that hormone produces and it's produced in high stress or exciting situations, right? It leads to physical boosts, heightened awareness. Noradrenaline or norepinephrine is a neurotransmitter that affects attention and responding. It's that fight or flight response. It increases the blood vessels, increases blood flow. Dopamine is associated with those feelings of pleasure and satisfaction. That, again, going back to social media, every time we get online, every time we get a like, every time we get one of those, we have a dopamine hit. So right now, we are working with addictive dopamine receptors. Dopamine is a part, if it's too much, is a place where addiction can fall. Serotonin, again, is thought to be a contributor of feelings of well-being and happiness, regulates sleep and intestinal movements. Exercise and light levels, so blue light, can also have positive effects on this. With us living in the Midwest in January, February, when it's gray, luckily we've had some pretty great days that maybe we're not feeling the effects of it so much this winter. But oftentimes in January, after those holidays, we feel that really blue January where we're just kind of blah. And that's because serotonin also feeds off of light levels, so can have some effects on our feelings. GABA is the inhibitory neurotransmitter of the brain. Its role is to calm firing nerves in the central nervous system, so this helps with mental focus and relaxation. Acetylcholine is the principal neurotransmitter involved in thought, learning, and memory. Damage to this area has been linked to deficits with memory and Alzheimer's. Glutamate is the most common neurotransmitter, and it's involved in cognitive functioning, learning, memory. It can be toxic to neurons in too large of a quantity. And then endorphins are a range of compounds that are released in the brain during exercise, excitement, pain, sexual activity, and produces a feeling of well-being or even euphoria. So as we can see from these neurotransmitters, there's a lot going on in our brain. And if pieces of these are off, it can cause mental health problems. So it's not just that we're feeling blue or we're not just stop worrying about it. There are structures in our brain that need help relearning, creating new pathways to get past some of what we're dealing with in those moments. So talking about how many people have a mental health diagnosis helps to feel not so isolated. Knowing even there's athletes and celebrities that struggle. That was the big thing in the last Olympics when the gymnast pulled out because her mental health was not allowing her to compete at the level that she should. It was dangerous at that point for her. So sharing these real life examples of these athletes that have gone through this and these athletes that they exercise every day. So it can't be that they just can exercise their way out of it, right? So part of this, though, is understanding our self-care. Part of helping our mental health and to keep it on track and to once we've overcome it, to keep so that we keep into our strong part of ourselves, we have to have self-care. This is a huge part of being able to maintain. So as we're talking about mental health, we also want to talk about self-care. Being mindful and intentional about it can help your mental health recovery. There's 3 central aspects to self-care: awareness of one's own needs and limits, being attuned to those, balancing life activities with work, play. There should be rest in there as well. And then connection. Connection's the antidote to isolation, to oneself, to others, to something larger. There's purpose. This offsets isolation and can increase validation and hope. So if we have that connection piece as we're going through our health recovery, or as a prevention and building resilience, those things right there can help offset isolation and increase validation and hope. That can offset some of those depressive pieces. So physical care, self-care can have direct impacts on our emotional and psychological, as well as our spiritual self-care. Aerobic exercise can reduce levels of the body's stress hormone. It stimulates endorphins. But again, if somebody is diagnosed with depression, anxiety, any of those things we've talked about, just going out and exercising is not necessarily going to do it for them. It could, if you're feeling blue, right, during those darker January months, it could help to get you through some of those times, but it's not going to be the answer for everything. Scientists have found that regular participation in aerobic exercise has been shown to decrease levels of tension, which could help with stress, improve sleep, and esteem. It can stimulate anti-anxiety type effects. But again, if we have, it's one of those things where if you do like a cross-body 5-minute video, that can help to calm somebody down with stress before a test. But it's not necessarily going to take away the effects of their worry about, those global big things that they're worrying about. But it can help to stimulate some relief for them. A great piece of spiritual self-care where we can start working on this, especially in our recovery phase, is spiritual self-care through meditation. Mindfulness is giving our brain a break from being on guard or looking in the future or shaming oneself by looking in the past. Mindfulness can reduce the activity in your amygdala, which is that stress response that can happen with perceived threats. So one of the ways that we can do a mindfulness practice to help shrink that amygdala is through grounding techniques. This is a super simple one that you can do in the classroom, at home for yourself. 5 things that you see in the room, 4 things that you hear, 3 things that you feel, 2 things that you smell, 1 thing that you taste. And taste could maybe be, I haven't had anything to eat for a while, so I'm thinking about the last thing that I tasted. So again, thinking about 5 ways that we're going to end mental health stigma, we're looking at educating ourselves about mental health, which we did today by talking about those diagnoses. We listen to and support each other with mental health concerns. So we're going to talk about our feelings. We're going to talk about that through emotional intelligence. We share real life examples of people with mental health disorders. So we talked about talking about those celebrities, talking about people that have overcome, sharing stories of overcoming mental health disorders, how we can help overcome mental health disorders, and then explaining mental health has that range of symptoms. Not everybody who has anxiety looks the same way. Things are going to look different. That's it for today. I tried to keep it a little bit shorter because I know with my other ones, we went right to the end and didn't have time for questions. So I definitely wanted to leave time for questions today.
Lindsay, thank you very much for sharing your expertise. We can open it up for questions. Either feel free to speak up or share out in the chat. We'll give you some time for that. I'm also going to drop, I'm also going to drop a link for our exit ticket into the chat. If you want to fill that out, you will be able to provide your feedback, ask any questions you may have, and choose your free book to add to your personal professional collection. I just want to leave it open for any questions or comments. If not, I want to thank everybody so much for their participation and showing up here this morning for our mental health and wellness series for the 22-23 school year, and have a great rest of your day.